I served in the military for 10 years. When I was released from active duty, I was diagnosed with PTSD, traumatic brain injury. I was on alcohol real bad for a very long time. I was taking all kinds of different medications because the psychiatrist that I was seeing, was just pushing pills after pills after pills. And so it was kind of like I was taking medication and it was a trial and error. Like, something would make me dizzy or something I couldn't sleep or different things like that. So it just got to a point where it was ridiculous with the amount of medication they were giving me to treat my symptoms. I have been in medical sales for a very long time, did orthopedics for a long time, and I actually had a recruiter contact me about this device, Alpha-Stim. And Alpha-Stim is what I've been using myself for the past about 2 years now. And it basically can treat, it's FDA cleared to treat anxiety, insomnia, and pain. I know there was, talking about depression a little bit, we used to be able to say that our device could treat depression too, but Big Pharma came in and told the FDA that only pills can treat depression. You know how that works. So we had to take that off of our label, but we used to be able to say it treats for depression. So this device has been a game changer for me. With using this, I have basically pretty much gotten rid of all of the medications that I was taking for all the various things. I was taking 400 milligrams of trazodone to sleep at night, which is way too much medication. The first time that I actually put this device on myself, I couldn't keep my eyes open after 60 minutes. And the device is not designed just to make you go to sleep. It's designed to take away your anxiety, which is the first and foremost thing that you're going to see with this. When you put the device on, if you're very anxious, within a couple of minutes, it's going to just bring you down from the anxiety and kind of give you some clarity. It may make you feel sleepy on the first time, but after that, you really do have the clarity and it can really treat that anxiety. On the pain side of things, you can also see initial relief for pain. It does take some time if you got some severe pain to use it over a period of time to decrease that pain down to where it needs to be. And then with the insomnia part of it, you got to wear the device for probably about 3 to 5 weeks to really truly see the full benefit of being able to get to sleep. So basically I want to kind of go into the science of the device. This company has been around for 40 years and they have taken this type of device and pretty much taken it from a box that was about this big, that was in a doctor's office, that you had to come in and make an appointment to be able to get the treatment, to whereas now we have 2 devices and this is the biggest one that we have. Okay. These devices for the anxiety and insomnia portion of it are done using ear clips. These ear clips will connect to your earlobes and it's done with an electrical current that will actually stimulate the vagus nerve in the brain. So we have an actual electrical current that we have patented that you can see right here that nobody else can use on their devices, because there are a lot of cranial electrotherapy stimulation, which is what this is, devices out there on the market, but they don't have the FDA approval to do the things that we can do with this device. So, basically, I started off with the smaller device, which only will treat with the ear clips for the anxiety insomnia. And then I moved up to the bigger device, which is the one that I just showed you, that can treat for the anxiety and insomnia with the ear clips, but then you also get the option of plugging in 2 probes. And those probes can be used to treat pain throughout various parts of your body. So if you have knee pain, lower back pain, all kinds of pain throughout the body, you can treat with this electrical current as well. So this bigger device out of the 2 gives you the option to treat all 3. If you're only worried about anxiety and insomnia, then you can use the smaller device, which comes in a pack about that big. And you can wear these around your neck. You can pretty much do anything except for drive or operate heavy machinery, because obviously you have a cord. You don't want to get that tangled up in the steering wheel. And when you put this on, it can give you a little bit of a dizzy feeling when you first start to treat. So we don't want anybody driving or anything like that. The other thing that I'll say with this is you cannot use this type of device if you have an electrical implanted device such as a pacemaker, cochlear implant, something that runs off of electricity. You cannot use this device with that. So that's the only thing that I would say as far as precautions go. As I said, this started off 40 years ago with a company out of Texas, and they kind of fine-tuned it down to where it is today. We have doctors that we have actually 100 white paper clinical studies that are already posted that are out there for people to take a look at to see the efficacy of the device. So, if people are like the deacon was saying, thinking it's snake oil, they can go onto our website and see that we have all of these doctors that have actually treated their patients and then did a published white paper to show that it works. So the doctors that we target with this device can be primary care, pain, mental health. We target first responders because they deal with, traumatic events on a regular basis. And there are a lot of addiction centers out there and recovery centers out there that are also using this device on their ward to treat their patients. The first patient that I had when I took over this device was a veteran that came out of Covington Behavioral Health, and they had one of these on the floor, and the veteran used it while he was there, got released from behavioral health, and then looked up the company online, found out that I was the rep, called me and said, I need one of these. So I was able to get it for him, which was great. And with that being said, with veterans, you can get it through the VA at no charge. As long as you go to your primary care or mental health or pain doctor and they can write a prescription, I can send them an email that'll show them how to put the prescription in so that they can get the device approved and sent directly to you. The downside of that is that private insurance does not cover the device. So, we've tried to work with some insurance companies and we haven't come to an agreement yet with any of them. A lot of them are they don't want to cover a lot of things, kind of like some people taking medication as well. But the way that I approach this and the way that the company approaches this is, as far as the cost goes, when you're talking about the smaller device, you're at about $865. When you're at the bigger device, you're at about $1,363, and that price just increased this year. We had a price increase. But, some people will kind of balk at that and say, I don't want to spend that kind of money. Well, think about how much money you spend on a cell phone. And when you upgrade to get the new cell phone, how much does that cost? This is something that you make the investment on the front end to pay for the device, and it could better your quality of life for a very long time. I have a friend of mine who is a combat wounded, Purple Heart. He does big talks in front of big groups. And every time before he does a big talk, he will go and put the Alpha-Stim on and wear it before he goes and presents. He's had his device for 22 years now. So, people may be familiar with like a TENS unit. A TENS unit has a lot of electricity in it. The way that they use that is they will just hit you with as much electricity as possible to try to alleviate your pain. But I think, kind of what happens is it kind of distracts you a little bit from the electricity that's being shot through. It does help with the pain some, but we do ours at a much lower level at 0.5 hertz. So it's a much lower level of electricity going through your body to be able to treat it. Yes?
I have a question, I'm sorry.
Yeah.
So I have extreme nerve pain, and like right now it's hurting.
Yeah.
Are you saying that the device that has the pain option in it, you would put it on at the moment that it's hurting and it's gonna make it feel better?
Yes.
And then what, you take it off after?
Yeah, so, basically people that would treat with this, you can treat as many times as you want in a day. We try to say if you're doing it for anxiety or insomnia, wear it once. But my manager was actually in a very bad motor vehicle accident. She had to have her face reconstructed about 20 times. And she was having major issues with sleep at night. So she would wear hers and then go to sleep and then wake up in the middle of the night and have this on her bedside table and put the ear clips on and was able to go back to sleep. So with the pain aspect, I'll give you an example. We had a veteran who was burned really bad from combat, and he had a bad scar all the way up his arm. And that scar tissue is very thick. It's very hard to penetrate through. We were able to take him from a 1 out of 10, he was at a 12. We were able to take him down from that pain on the first treatment down to about, I think it was a 6 or a 5. And that's huge for somebody, especially with scarring like that.
So, are you familiar with a spinal cord stimulator?
Yes.
I was actually supposed to be having it put in a couple weeks ago,
Mm-hmm.
and this has been going back and forth because of insurance and this, that, and the other. But my neurological pain management doctor was going to put it in, but he said my spine was too tight, and with the scarring and all that stuff, because I've already had a couple of neck surgeries.
Yeah.
That he couldn't do it, and so the neurosurgeon
Mm-hmm.
looked at it and was going to do it. Well, being that it keeps getting shut down, I have 2 things that I hear is like, don't give up, because it's supposed to be a great thing, but then
Mm-hmm.
I have some fear on them opening me up and putting this in
Absolutely.
and being in there for the next 10, 11 years.
Mm-hmm.
Yeah, I mean, so compared to, and I'm diagnosed with chronic regional pain syndrome. I don't know. Like, I'd like to just say, how do I know that it really works? You know, because like I live in pain.
Yeah.
It had gotten much better when they put me on a particular medication, Belbuca,
Mm-hmm.
but I got into a car accident and it just shook everything all up.
Yeah.
And so I want to get out of pain, but I don't want to do anything that's going to harm myself.
Well, yeah, so you bring up a good point. Those of you that are interested in getting the device, if you're going through the VA, it's pretty easy. You can go to your doctor and it's already in the system. If you're going to a particular doctor and you would like to try this before you actually purchase it, I've left my business card. I hope everybody got my business card and brochure. Give my business card to your doctor and say that, you would like to be able to trial the device. And I can come in, I can bring your doctor a trial device to be able to let you try it to make sure that it's going to work for you before you purchase the device. So we certainly don't want somebody just going out there and buying it if it's not going to work for them. But it's not too many times that I've heard of that it doesn't work for a lot of people. It's not going to solve all your problems, but it's definitely going to decrease the pain substantially. So, mm-hmm.
How long would a treatment be?
So the way the device works is there are settings on it once you turn it on, and the treatment settings are anywhere from 20 to 40 to 60 minutes. So there's a 1 to 6 on here as far as the power goes. So when you start off to treat, you put the ear clips on and it's set at 1. You turn it up half a click, wait a few seconds until you start to feel like a rocking boat motion, kind of like a dizziness. Once you feel that, then we go down 1 click and let it run its course. If you're over 2.5, you can do a 20-minute treatment and you're good. If you're under the 2.5, we recommend 40 to 60 minutes. My personal recommendation of what I do is that I wear it for 60 minutes every time. It doesn't matter where you turn it up. You're not getting a better treatment if you do it for 20 minutes at the over 2.5. It doesn't matter if you turn it up. It's not really going to treat you any better than what you would be at a 2 or 1.5. So yeah, it's 20, 40, and 60 minutes.
You start off at what?
At 1, and it goes all the way up to 6 in half increments. So it'll go 1 to 1.5, 2, 2.5, up. And as you click up, you wait a few seconds to see if you feel that, and then go up to the next one. And once, yeah, if you feel it, you don't, you stop. Once you feel it, you want to stop and then go down 1 click and let it run its course.
So Brian, you use it for 60 minutes one time a day, or you could use it again later in the day?
We recommend 1 time a day if you're treating for anxiety or an insomnia. Pain is more, people will use it more times throughout the day. But what we've found is that as they use this device on a regular basis, it helps to decrease the more times that you use it. So just like it helps with sleep, not to say that you're not going to get benefit of sleep when you first start using it. You may get a little bit more, but we don't really see that full sleep that you want to get for probably, anywhere from 3 to 5 weeks of wearing it to make sure that you're in a good pattern with it. But once you get to that point, people have told me that they use it 3 times a week, 2 times a week,
Can you just switch over to the other device, say, or not device, but
take the probes off. So where your ear clips, where your ear clips plug in, your probe has the same cord that will actually, you can take that off and plug in your probes to treat for pain. But with the protocols that we use, even if you're treating for pain, you would start off treating the affected area with the probes. You can do, like, if you had probes on your knees, you can do your star treatment on your probes, and there's videos to show you how to go through the pain treatment protocols. But if you get to an area where you can't reach with the probes, then we also have the electrodes that you can stick. Like if you're trying to treat your shoulder, you can put an electrode on the front and back of your shoulder and let it run its course without having to hold those probes there, which is pretty nice too.
EKG patches?
They're EKG patches, pretty much, yeah. And right, correct. And then once you're done treating your pain and you've gone through your whole protocol, like if you were doing your lower extremities from your waist down, like if you were treating a knee, you would treat the knee in a star pattern, but then you would go down and treat your toes all the way across, starting at your big toe all the way down to your small toe. There's 10-second increments on the pain treatment, and you'll hear the device beep. As you touch it, it'll beep. You'll go to the next one. That way you're getting the electrical current to travel all the way up and down your both legs to be able to get the full treatment. And it's actually treating other things if you have other pain on your lower side. The same is true for the upper, where you would do your fingertips. Once you've done that protocol, we recommend that you put the ear clips on. Even if you're not treating for anxiety or insomnia, it's just for pain, put the ear clips on, because a lot of pain originates in the brain, right? So there is a ton of videos, like on YouTube. If you go look up Alpha-Stim on YouTube, our doctor who designed this actually shows different protocols of treating areas for pain, treating for anxiety, and for insomnia. So if you get the device and, either I go over it with you or the doctor goes over it with you and you forget the steps, you can always go and look at those videos to kind of refresh yourself on what you need to do. Yes, ma'am.
So is the idea to calm an overactive vagus, or?
So what it does is it'll stimulate the vagus nerve, but it's with such a low electricity level that it gives you the calming effect.
So it's really, you're trying to get it out of a hyperactive mode? is
Correct.
What you're trying to do? You're trying to break that cycle?
Correct.
Like if you were breaking a muscle spasm?
Correct. So a good example, and this is one that I heard like when I first started. They've got a med spa in Metairie that actually uses this device, and there was a lady that was caught up in a high-speed chase in downtown New Orleans. She went into the med spa and they hooked her up with the Alpha-Stim because she was freaking out, and within 2 minutes she was completely calm, like it never happened. So psychiatrists, when I try to approach psychiatrists with this, there are so many older psychiatrists that are stuck in their training as far as prescribing medication. They believe in medication, that's what you need. So it's a little bit harder for them to see this alternative treatment as something that's viable just because they're used to the medication. But if you get a psychiatrist like that, you can always use this device in conjunction with medication to start off with. And then your goal down the road can be to get rid of that medication once you've used the device for long enough. But some of these psychiatrists that are starting to implement this in their practice, they're able to see their patients come in that are going through so many different emotions, and they put the ear clips on and they're able to relax and focus on what their actual problems are so they can have a great session with their doctor, because it gives them clarity and it calms them down to where they're not so amped up throughout the session. So, you know, I've got right now Louisiana State Police, East Baton Rouge Parish Sheriff's Office, New Orleans Police. There's a bunch of fire stations, EMTs that are also wanting to use this. Just so you're aware, I work with a lot of Special Forces guys in the Army, and there was actually a doctor that was at a conference in San Antonio who was a Special Forces doctor, and he was telling us that when the Special Forces guys go down range to do their thing, when they come back to decompress, they put on Alpha-Stim. So if it can do things for those guys, it can do a lot. And we've had a lot of great success in so many different areas. What we can say, as I said before, with the FDA is only the anxiety, insomnia, and pain, but I've had people come to me and say they've got migraine headaches and it helped with their migraine headaches. TMJ, it's helped with that. Somebody was telling me that they used it and it lowered their blood pressure. You know, this thing can do so many different things, but we can only say those 3 things because that's what the FDA approves us to say. So I think it's a great alternative. I know there are several pain doctors and pain groups that I have called on and talked to, and they're being scrutinized for pain meds. You know, they're being looked at for how much they're prescribing to these patients because of so many addiction rates and all that kind of stuff, to where now they're saying, I need the alternative to this. If you look at the big picture of what RFK wants to do in the United States as far as health goes, you know, Big Pharma's sweating a little bit about that, because if you look at the medications that Big Pharma's put out, they've made billions and billions of dollars, and what have they cured? You know? So this is a non-invasive treatment that you don't need medication for, and that you can actually reduce your medication. Yes, ma'am.
Any side effects that go along with it?
So the only side effect that we've heard is every once in a while, and it's not very often, after someone does a treatment with the ear clips, they'll take the ear clips off and they have a little bit of a heavy feeling. And, you know, we just tell them to put the ear clips back on for 5 minutes at the setting that they were on, and it'll usually clear that up with no problem. Yes, sir.
Prescription is required to get it.
Prescription is required. Unfortunately, you can't go online and just order this, and that's kind of how it differentiates us from the other companies out there, saying that everybody's trying to treat anxiety because so many people have it.
You said it's good for PTSD.
Well, I can't, you know, we can't say that, but yes, anxiety, you know, related to PTSD is what we kind of have to say. I have PTSD, I've used it, it's done amazing things for me.
The VA is pretty receptive to getting their on this stuff.
The New Orleans VA it's been a little bit of pushback, but I've kind of redirected because there's a lot of doctors there that rotate from different hospitals like LSU and Tulane, and they spend a little bit of time at the VA, so they're not like dedicated VA doctors. Those doctors are not really as receptive to something like this just because they're there to do their time and that's it. So I can direct you to doctors that are within the VA system that are currently prescribing, because we've got a doctor in Hammond. Unfortunately out here we don't have one prescribing yet, but we're getting ready to get that changed. Bogalusa, Homa, and Franklin, I think, they're all prescribing. And then, you know, it's in the New Orleans system, so all they have to do is put in the prescription and it's done.
Are you familiar with the VA hospital up in Sheridan?
Where at?
Sheridan, Wyoming?
No, sir. I'm not sure. I could check into it for you, but you can also go online onto our website, and you can call the customer service number, and they can look up the VA in that area, and they can let you know who exactly you need to talk to about that. So you're from Wyoming?
My son is.
Okay, gotcha,
He's got the problem.
gotcha.
So it's available nationwide.
It is, absolutely. Yes, ma'am.
To ask you, how would it be used if you're trying to focus on insomnia? You know, where you're already taking medication, and I had migraines, but they're much, much better.
Mhm.
But it's the sleeping medication that helps me supposedly with the migraines.
Yeah. So you can use it in conjunction with your sleep medication, but what we say if you're treating for insomnia is you don't want to wear this right before you go to bed because it does stimulate your brain. So we say that usually 1 to 2 hours before you go to bed, put it on, let it run its course, and then, give your brain a little bit of time to kind of relax. But you can use it with your sleep medication, and it's not gonna change the treatment of what this will actually do for you. Yeah, so like I said, I was on 400 milligrams of trazodone, and now I don't take that, which I'm pretty happy about. Yes, ma'am. Yes, there's a 5-year warranty with it.
How long does the average machine last?
We don't have an average time, but we have so many machines that I've talked to people that have had them for 25 years, 20 plus years. Our customer service is outstanding. If you have an issue with something and something's not working, they can work with you to get it resolved. The only thing down the line that you may have to come out of pocket for is the little disposables. There's disposables on the ear clips that you use. There's a conducting solution that you use on the, disposable ear clips and on the probes to make sure that, you've got good connectivity on the skin. But those are very minimal costs. So,
Major appliances today you can't get last 20 years.
yeah.
They're made for obsolescence.
Yeah.
Did I read there was a 30-day money-back guarantee to use it for a month?
Yes, ma'am.
It is an additional cost for the leads that allow you to go longer, in distance. Didn't you say something about if you can't reach a certain spot?
Oh no, that's for they're just like EKG.
It comes with the pain packet.
See the little
Yeah.
little pads like that? So if you can't reach with the probes, like to treat your shoulder, you can take an EKG patch and put them and run your treatment without having to hold those probes. Yes, ma'am. Yeah, in the M device, which is the bigger device, that treats pain. It'll come with these, the probes and everything that you need comes in the packet. They come in a little pack like this, and when you open it up, it's got everything in there that you need. It's got an instruction manual. It's got, pretty much everything that you need, but we want to make sure that you're covered too, and that's why I gave everybody a card if you want to get a device. And if the doctor doesn't really go through it in detail with you so that you understand it, you can call me anytime and I'll go through it with you. We got the videos online. We want to make sure that you have the opportunity to be able to do this. The thing for me is I wanted to use it myself before I went out and sold it, because I don't want to go out there talking about something that I don't believe in. And the things that this has done for me is amazing. So that's why it's a passion of mine. That's why I will go out and speak anywhere to let people know about this, because I think the biggest problem with this company from going way back is they didn't have the representation they needed in the field to be able to get the word out that this was available. There's so many people out there, when I approach them about this, just like me, I didn't know, And once they understand there's another treatment option that is not medication and there's not many side effects to it, it's kind of a no-brainer. So.
And we can only get it through a doctor. You can't sell it to us.
I cannot. Yeah, it has to be prescribed by a doctor because they want to make sure that you have a symptom that would align with using the machine, which means pain anywhere in your body, anxiety, and insomnia issues.
So what happens if you don't have the symptom when you use the machine?
So I'll give you an example. So let's say there's a couple and the husband gets the machine for pain, and the wife wants to use the machine. There's nothing wrong with that. I mean, you can do that. If you've got a machine at your house, nobody's going to know what you're doing. But I've seen that many times where a couple will get a device and they'll use it between both of them. The only problem is they end up arguing down the road who gets to use it. So, you will have that issue. And I've seen that.
Clarifying, so a primary care physician could get a trial, one of the devices to use and keep in their office as a trial for patients?
Absolutely. Yep. I've got trials that I keep with me to where if a doctor would like to have one in their office to trial on their patients so they see how it works for them before they purchase it, then we do that. There's some doctors that'll buy devices and keep them there in their office and rent them out to patients. Give them, they'll have them give a deposit or something like that and let them take the device for a certain period of time. There's a number of different ways that you can do it, but the good thing is that I can get the trial there for you so that you guys use it before you ever have to make the purchase. Now, going through the VA, you don't have to do that. They do, some VAs will require a trial, but most of them right now that are being prescribed are not required.
So I have to go to my doctor, give him your information, explain to him that I would need a prescription for this, and that he needs to contact you,
Yes, ma'am.
to set up.
So that I can come in and let him know about the technology and get him set up with a trial device.
Do you have any doctors in Battery right now that do that?
I've got not VA, Dr. Podesta over there. She does quite a few, and we've got various doctors throughout New Orleans, Baton Rouge, and the whole kind of surrounding area that are doing it. But if you've got a question on a certain doctor when you're going to get it done, just contact me and I can direct you exactly where you need to go. But I would look up Dr. Podesta. She's pretty big with it as well. Yes, ma'am.
Okay, so how do you treat like migraine headaches and usually their eyes hurt?
Mm-hmm.
My daughter.
Yeah.
So how do you treat that
With the ear clips.
okay.
Yeah, with the ear clips. And because that's going to do a whole function. Now, if you get to a point to where it's hurting below where the base of your neck is, down in that area, then we can recommend that you can treat with probes with that. But you're still going to end up putting ear clips on to be able to do the full treatment. The people that have told us that they've gotten relief from the migraine headaches were wearing their device for either anxiety or for insomnia, and they had migraines as well, and they were relieved of their pain.
Have you ever heard of POTS? P-O-T-S?
I'm not familiar with that.
It's
The head to toe basically problem.
yeah, it's like I'm not sure what it is. My daughter was in an accident and now she has, which is like migraine headaches and her eyes won't focus and stuff like that.
It's an autonomic nervous system disorder, where when they get up on laying flat,
Yeah.
the heart rate goes up very high, tachycardia,
Oh, wow.
because the blood isn't getting up to where it needs to.
Hmm.
So they feel dizzy, they feel nauseous, a lot of times headaches. So
I certainly think that it could help. I'm not going to tell you that it's going to relieve all of her pain, but I would definitely try it. I don't see how it would be, doing anything negative. I think it would definitely help with at least pain, potentially the headaches, potentially even the blood pressure. But you didn't hear me say that.
Does it run on a battery?
Yes, it's 2 AA lithium batteries. So you want to make sure that you're using lithium batteries only with these devices. AA for the bigger device, AAA for the smaller device.
You mentioned something about TMJ.
Mm-hmm.
Can the dentist prescribe this?
Yeah, so we actually have this at a lot of dentist office, and not just because for TMJ, because we can't say that it treats TMJ, but we have it at dental offices for procedural anxiety. Because there are a lot of dentists out there that they have patients, they book them to come in to do a big procedure in their mouth. They're too anxious, so they don't show up, so the dentist is losing money. So a lot of dentists are wanting to have one of these in their office to where they can have their patient come in a little bit earlier, put on the Alpha-Stim so they're relaxed before they go back to have their dental work done. Anybody else?
Brian, I got a few questions.
Yes, sir.
You mentioned about pacemakers.
Mhm.
What about microwaves? Does that interfere with it in any kind of way?
No, sir.
You said it's not improved by insurance. What about Medicare and Medicaid? Do they approve that or not?
No. Yeah.
Okay. User specific, you said it's not user specific. Anybody could use it. If I buy one, anybody could use it.
What I'm supposed to tell you is that if it's prescribed for you, you're the one to be using it, but nobody knows what you're doing as long as, you're not using it on somebody that has an electrical implanted device. Then, that's just what we're looking out for as far as warnings go.
And you mentioned, what about long-term use if you use it a lot? Like some meds, if you take meds, it kind of like it wears off or it doesn't. You just up the dosage to compensate for that, or?
With this, I haven't heard anything that over a period of time that it's going to decrease what it's doing for you, but you can always use it more frequent than what you have been using. If you're using it once a day and you feel like you want to try it for twice a day, once in the morning, once in the afternoon, there's nothing wrong with that.
Is there a limitation on how many times you can use it?
Not at all.
So you're saying you don't build up a tolerance?
No, ma'am.
Is it doing muscle memory? Is that what it's kind of doing with the?
Yeah, it's just the electrical current going through the body. So, once you, over a period of time, have the exposure to that electrical current, then it kind of, it knows what to do once you've treated an area and it's gone through the treatment. It's not like a muscle memory, but, it's certainly something that over a period of time using it, you're going to feel more and more of a benefit.
There's a different protocol for pain, anxiety, or is there a different protocol with the unit?
Yeah.
Or is just clipping it on the ear to take care of all three of them at the same time?
The pain is not with the ear clips, and that's why if you just have anxiety or insomnia, you want the smaller device, which is called the Aid. That only has the ear clips. If you have pain as well, you want to have the M device because that comes with the actual probes that you can plug in to treat for pain. So the M device, I've had a couple of doctors when I've approached them and they said, well, I'm treating my patient for anxiety. I don't want to get them this device because right now they don't have pain. On the military side of things, I tell the doctors if they don't have pain right now, they're going to have pain. So they end up getting the bigger device anyways, but it's really up to the doctor who's prescribing the device, what they want to prescribe it for. But as long as they target one of those three areas, then you shouldn't have an issue.
On the sleep protocol, when would you use that? Before you go to sleep, or?
They say probably about 1.5 to 2 hours before you go to sleep, just to be safe. I was saying 1 to 2, but you're probably better off doing about 2 hours before you actually sleep, just because it stimulates your brain so you wouldn't be able to go right to sleep.
That's all I have.
If a person is trying to detox from a drug,
Mhm.
Do you think that this would be a device that would help them?
There are no studies on that. Well, there may be actually. I may be mistaken on that. I think we've got a few studies from behavioral health areas because we do have doctors that use this specifically for addiction. So, I believe we probably do have a couple of studies out there. I don't know what the results of that would be. Like if you have somebody who's detoxing, I would think that this would certainly calm that person down because a lot of people that detox are going through the shakes and, all these different things. Yeah, so I think that, it would definitely help tremendously. Yeah. And that's why we have different behavioral health centers across Louisiana that have it at their facility now to let some of the folks that are there, especially the folks that say, I don't want to be on medication, or I've been taking medication, it's doing bad things for me, or the doctor's concerned about them being on medication over a long period of time. Mm-hmm. Any other questions?
Everybody.
Lisa here has tried it out. You want to tell us what you thought about it?
Pain and anxiety and insomnia and all, but for somebody that doesn't have those things, Lisa tried it.
I did. Actually, Brian and I both know the same therapist at Covington Behavioral Health. She worked on the veterans unit when I started working with veterans, and she started telling me about it. Not only does she use it as a social worker on the unit, but her father is a physical therapist up in the Shreveport area.
Mm.
And he's been using it and prescribing it for years, and I had never heard about it. And she kept telling me, just like how he's talking about it. So I was going to Covington Behavioral Health one day, and we were going to be there for a couple hours for a continuing education event. So I said,
bring the device so I can check it out. So exactly what he said. I was sitting in the front of the room, she was sitting in the back, and she was kind of texting me that we were going through. So you did exactly what he said. You clip the device on, and then you just slowly start putting it up. I think it goes up a half at a time.
Half, yep.
At a time.
Mhm.
And then you just kind of feel, it's just a little lightheadedness you feel, and then you would just, I backed it down. And I literally just sat there with it on. And I don't know what you're doing like as you're sitting here, but you're not just listening to Brian. And you're not completely focused. You're thinking, okay, what are you gonna do when you leave here? You know, are the kids gonna be in bed when I get home? You know, all this stuff is going through your head. So she's texting me from the back. She goes, well, do you feel anything? I said, no, not yet. And this was only about maybe 15 minutes in. I hit that 20-minute mark, and I had never been so clear, so focused, and so present, probably ever in my life. And it wasn't, I didn't hear any tingling, I didn't feel any, it truly was like, I don't know, back in the day, you know, your grandmother's old clip earring, you know, those old earrings that's basically what it felt like. But it had the little rubber things, it wasn't squeezing the hell out of me.
I'm not familiar with that.
You know, you still wear them? No, anyway, so I'm a true believer in what it does. And I was skeptical because, you know, when I put it on, I was going to try to tell her this is a bunch of crap. And she grew up riding horses, so she had the one that has the probes too, and she's never had to be on any type of medication for pain or any injury she's had during her horse riding days. So I had Brian come to Patriot, where I'm now working, and we deal strictly with veterans, and he met with our whole clinical staff. I don't even think he had pulled out of the parking lot and we had already put in a prescription for two of them. For a patient that was getting ready to discharge, and then we had gotten one to have on the unit because we get people that come to detox. We get people just so they can be exposed to it, and in that way, if it's being useful, if they're getting benefit from it, we could put the prescription in and they could have it before they went home.
So you're saying it helps you focus?
It was so.
Seems like that could help somebody with
Well, and you figure the
attention
anxiety.
deficit disorder.
That's what I just thought of, ADHD, like, have you
ADD
ever,
definitely.
have you ever, like, pitched it to people that have?
I'm trying to get him to pitch it to everyone. I don't know how many times.
Yeah, right.
Yeah.
Just seems like that.
Yeah, but if you have, like,
Right.
Well,
And if you're
like
in-
kids
But
with
you'd have to have a
hyperactivity.
prescription for one
Right.
of those
Right.
things to get it.
Right.
You can use it for, but you don't.
And then if you're in recovery,
That's the focus.
Well, instead of like, you know, pilling them.
right,
Yeah.
For ADHD, maybe
right.
buy one and,
Because we see those kids later, like back in our,
Yes.
we see them later down the road
Right.
when they've been on those medications.
right, instead of medicating them, maybe this works for.
And if you're in
something like
recovery and you
that.
get to that, we call it jonesing, but all those feelings that start coming up when you're hitting that relapse mode, this would be very, very helpful for that, to just rein you back in.
I'm just saying you could target ADHD.
I was so present. And
Yeah.
It was great, and I was determined to make sure it didn't work. I was like, there's no way this is gonna work.
Yeah, and I didn't mention this, but Alpha-Stim actually has a page where we use this on animals that are hyper, you know, that are scared. They put ear clips on their dogs when they, you know, freak out because of weather, you know. So there's so many different uses.
My son's a veterinarian. Before 4th of July next year, I'm gonna get a bunch of them together because that is huge.
Yep.
It is huge because what happens is the dogs end up they get so upset, they get lost.
Yeah.
Like they go running out of the
And
yard.
that's anxiety.
Mm-hmm.
So if we get a prescription written,
Mhm.
then you go to the pharmacy?
No, so basically what will happen is the doctor that writes a prescription will turn it in to our company, to our corporate. They'll give them either an email or fax or whatever. They can send it up and then the device will be sent directly to you. Yeah.
And did you say you had doctors in Slidell that do it now or no?
Not in the VA. I mean, that's going to happen soon, but I don't think there's one specifically right now in Slidell, but any doctor that you bring it to and you tell them that this is what I'm interested in, if they're open to contacting me to talk to me about it, I can help them walk them through the prescription and get them a trial device so that they can trial it on you, you know, before you purchase it.
And when you say trial before you purchase it, like the 20 minutes, or we get to take it for 6 weeks and see if it really works to help sleeping?
That's really dependent on what the doctor wants to do. Typically, you know, they would do a trial in office. If it was for anxiety, you could do it right there and see what the reaction is. If it's for pain, they could do it right there in the office. If it's something like insomnia, that would be something you'd have to take home and trial for a few weeks, because you're not going to see the full benefit until you've worn it that period of time.
What about bipolar disorder?
Yeah, I'm not sure about that.
That's like,
I just read a review on it and they said they used it for that. And also for perimenopause.
Yeah, I mean, it's used for so many different things, but we can only say the 3 that the FDA approves us for, you know. But yeah, if you, like I was alluding to before, if you look online, there's a lot of what they call CES devices, which is the cranial electrotherapy stimulation devices. And you're going to find a lot of those devices cost less than this device costs. A lot of those devices do not have FDA approval to be able to treat anxiety. So make sure that when you're looking at these things, you're comparing apples to apples. You want to make sure that whatever you decide to go with has clinical white paper studies done by doctors who have treated their patients to be able to see the efficacy of the device. You know, I see these, you know, advertisements in different magazines for these things you can hold in your hand to treat anxiety and different things like that. I mean, everybody's trying to sell something. You know, we have the backup to be able to back what we can do with this device for our patients.
So it's FDA approved, but insurance companies have yet to cover it, correct?
Correct.
And I'm sure they're working on it.
We've been working trying to get this approved through insurance. Unfortunately, and I see it really bad on the military side too. It's just very unfortunate that like active duty soldiers have a problem getting this because TRICARE, their insurance will not cover it. But if you look at insurance companies as a whole, a lot of them really don't want to cover much, So if it's something like this, it's a device that, they don't see coming from Big Pharma or something like that, then they're not as interested to approve it.
I just recently got hearing aids, and the price of this is 1/4 the price of hearing aids.
Yeah.
Again, hearing aids help you function and communicate, and if this helps with all these things you're saying, it really is worth the money.
It is.
I just thought of something when she said hearing aids. I wonder if it helps with, ringing in your ears.
It does, because I have tinnitus. I have ringing in my ears, and it has definitely improved that for me. So, but anyways, thank you all very much for your time tonight. I hope that I've shared some information with you to kind of show you an alternative treatment option that's very non-invasive. With this being for substance abuse, obviously there's a lot of different groups that are using it in their substance abuse areas because it does help with their patients. And any additional information that you'd like to get, my number's on the card. You can look at the website, and there's all kinds of videos and great articles you can look at as well to do some research on your own. Just, I know a lot of people would like to do that themselves. So, yep. Thank you.